Hard or soft toothbrush? Hi, this is Dr. Hannah, your patient-centered dentist. Let's settle this question. Is a hard toothbrush better because it cleans more? The short answer is no. A hard toothbrush doesn't clean better, it just scrubs harder. Black is soft. It doesn't require force to remove. It requires technique and time. When you use a hard bristle brush, especially with heavy pressure, you can actually wear down the enamel, cause gum recession, create tooth sensitivity, and damage the gum line over time. And once enamel wears down or the gums recede, they don't grow back. A soft bristle toothbrush used gently and consistently will remove plaque just as effectively without damaging the protective layers of your teeth. Think of it this way, you are not scrubbing a dirty pan, you are caring for living tissue. Small circular motions, light pressure, 2 minutes. If your toothbrush bristle flare out quickly, that usually means you are brushing too hard. So which one is better? For almost everyone, soft wins. Gentle, consistent care protects your smile longer than aggressive brushing ever will. Well, do you brush harder or longer thinking it will clean better? A lot of people believe the harder you scrub, the cleaner your teeth will get. Like I mentioned before, black is soft. It doesn't require force. It requires time and technique. Similar to using a hard toothbrush, brushing harder can actually wear down the enamel, cause gum recession, lead to sensitivity, etc. What actually works? Brushing gently for a full 2 minutes, small circular motions, and soft bristle with light pressure. Think of it like washing a car. You don't scrub it with a wire brush. You take your time and use the right tools. Gentle, thorough, consistent. That's what keeps teeth healthy long term. Water flosser or traditional floss, which one is actually better? I get this question all the time. Traditional string floss is still the gold standard because it physically scrapes the plaque off the sides of your teeth, and that mechanical removal is important. A water flosser is excellent at flushing out food and reducing inflammation with a steady stream of water. It's especially helpful if you have braces, implants, bridges, or tight space, but it doesn't scrape plaque the same way string floss will do. So what works best? If you can use traditional floss properly with good technique, that's ideal. But if you avoid flossing, struggle with the technique, have braces, or have dexterity challenges that make string floss difficult, a water flosser will absolutely do a better job than inconsistent or ineffective flossing. For some patients, using both give the strongest results. At the end of the day, the real question isn't which one is technically better, it's which one you will actually use consistently, because the best tool is the one that becomes part of your routine. Are floss picks just as good as regular string floss? They are convenient, they are easy, but they are not quite the same. With traditional string floss, you wrap it around each tooth in a C shape and slide gently under the gum line. That allows you to clean both sides of every tooth thoroughly. With a floss pick, the string is tight and fixed in place. It doesn't wrap around the tooth the same way to scrape plaque off the surface, so you often just snapping it straight down and pulling it back out. You may get some food out, but you are not cleaning the full surface area. Another thing, most people use one floss pick for the entire mouth. That can move bacteria from one area to another. But here's something important. I would rather have my patients using a floss pick every single day than not flossing at all. Floss picks are great habit builders. Once flossing becomes part of your routine, it's much easier to improve your technique and eventually upgrade to traditional string floss. Better habit first, better technique second, because consistency always comes before perfection.